day. So for our meeting today, I'm going to discuss lesson 9, your synovial fluid. So you've already heard of this type of fluid class in your laboratory and even in your other subjects, especially in your anatomy and physiology. Now, synovial fluid class basically refers to the fluid lubricating our joints. So siya yung fluid class that would allow our joints to have a smooth movement. It acts as a lubricant. It is a viscous, mucinous substance in close resemblance to egg white. It resembles egg white class, yung white part ng egg. Now, what are the functions of your synovial fluid? It reduces friction between the articular cartilages of your synovial joints during movement, circulates within a joint to provide nutrients, responsible for waste disposal for the chondrocytes, and helps distribute pressure evenly across the joint. Now, let's talk about their physiology and composition class. So, all human joints class, except those that are weight bearing, are lined with a tissue called synovium. Take note class yung mga joints natin, except those that are weight bearing, are lined with a tissue called synovium. Now, itong synovium na to class, the bones in the synovial joints are lined with smooth articular cartilage. So, if you take a look at this picture, ito yung bone natin, class. This is the bone. Now, lining the bone is that there would be a smooth articular cartilage. So, itong blue na to. This is the smooth articular cartilage. Now, this is separated, class, by a cavity. This is known as your synovial cavity, separated by the synovial cavity. So, itong space na to, this space is known as your synovial cavity. Then the synovium class, listing note, is lined with specialized cells containing synoviocytes. So the synovium, the cells lining the synovium class are known as your synoviocytes. So synovial fluid is formed from the ultrafiltrate of plasma passing through a double membrane barrier. This filtration is non-selective and allows the entry of glucose and uric acid. So if you notice class, karamihan ng mga body fluids nyo with the previous discussions are also ultrafiltrates, meaning they are highly sterile. But the thing you need to take note of this sa synovial class is that it would allow entry of glucose and uric acid. So, pwedeng pumasok yung glucose dyan. Glucose and uric acid could enter that cavity. Now, the synoviocytes class would secrete what we call hyaluronic acid. Now, hyaluronic acid and a small amount of proteins to the synovial fluid. Now, itong hyaluronic acid natin, class, this hyaluronic acid contains molecules that are responsible for the viscosity of your synovial fluid. So if asked in your quiz or in your exam what causes the viscosity of your synovial fluid, the answer is hyaluronic acid. Now let's talk about their collection. How do doctors collect your synovial fluid, class? So this is collected, class, through the process known as your arthrosynthesis. A sterile needle is punctured on the joint of the patient and is collected by a physician. Again, class, we do not collect body fluids. Only doctors are allowed to collect body fluids. So again, the proper sterile. So you need to practice aseptic technique. So you need to clean it with an alcohol. After cleaning with the alcohol, you clean it with a betadine or iodine prior to collection. Now, what are the sites of collection, class? So you could collect in the joints found in the knee, the shoulder, or the elbow. Most of the time, class, kinokollect siya sa knee. Now, there is only one puncture but two thrusts of the needle. So, the first thrust of the needle, class, is skin penetration. So, kunwari ito yung joint. In between the joint, class, tutusok yung doctor, first thrust. That would be the first thrust. The purpose of the first thrust is so that the needle would penetrate the skin. Now, after that nakapasok na siya, the doctor would again penetrate it for the second time so that the needle could enter the fluid capsule or yung cavity, yung synovial cavity. Then from there, i-aspirate niya na yung sample. Now to do this class, some doctors would use ultrasound as a guide for arthrosynthesis. Kasi again, very very sensitive ang bones natin. Imagine if your bone is punctured by a needle, sobrang sakit niyan even with an anesthesia. So to prevent any mistakes, doctors would use ultrasound. Now, a bulge test class, this is done over an affected joint to detect for increased synovial fluid. So for doctors to know if there is increased synovial fluid, they would do this bulge test. So indications when to do this: suspected effusion in the knee, inflammation of the knee, and if upon palpitation there is swelling, redness, heat, or pain. There are no contraindications. So when you say there are no contraindications, class, the doctor could do the bulge test anytime. So the positive test class would be a wave of fluid seen in the medial joint line. So merong parang fluid na gumagalaw-galaw class in the middle of the joint line. So the normal amount of fluid in the adult knee cavity class should be less than 3.5 ml. So the normal volume class, the normal volume of synovial fluid is less than 3.5 ml. But if the patient is suffering from inflammation, it could increase greater than 25 ml. Then take note, class, that normal synovial fluid does not clot. However, fluid from a diseased joint may contain fibrinogen and will clot. Therefore, fluid is often collected in a syringe that has been moistened with heparin. So most of the time, class, when doctors perform arthrosynthesis, yung syringe, gagawin nila, they would aspirate liquid heparin. The reason for that, class, is some cases na kapag merong inflammation, there's infection, there would be fibrinogen. And fibrinogen, class, will cause your synovial fluid to clot. So to prevent this, they would use anticoagulants, specifically heparin. Then specimen for crystal analysis should not be refrigerated, class, as they can produce additional crystals that interfere with the identification of significant crystals. So these are the different anticoagulants, class, used for different types of tests for synovial fluid. So for tests use for gram stain. So for synovial fluid used for gram stain and culture, you are required to use heparinase or yung SPS, the sodium polyanethol sulfonate. Then if you're going to perform cell count on your synovial fluid, you would use the anticoagulant liquid EDTA or heparin. Then for glucose analysis, you could use sodium fluoride. Then for all other tests, you could use a non-anticoagulated syringe. So powdered anticoagulant should not be used, class. Take note, powdered anticoagulant should not be used because they may produce artifacts and interfere with crystal analysis. Kasi di ba, if you're familiar with some anticoagulants, yung K2, yung K3, these are EDTA class that are either in powder form or liquid form. So as much as possible, when you collect synovial fluid using anticoagulants, you need to use their liquid form to prevent the formation of artifacts affecting crystal analysis. Now let's talk about the physical analysis of synovial fluid class. So as mentioned earlier, normal synovial fluid class would resemble an egg white. And you would assess the following: the color of the synovial fluid, the clarity, the volume, the viscosity, and the clotting mechanism of your synovial fluid. So let's start with the color and clarity. So take note of this, class. The normal color and clarity of your synovial fluid should be clear. The clarity should be clear, and the color should be pale yellow. Now, if there are certain disorders, example, inflammation. In inflammation, class, your synovial fluid would appear deeper yellow. If there's an infection, it would appear to have a greenish tinge. Then, if the doctor accidentally caused traumatic collection, when you say traumatic collection, just a recap, sa CSF nyo and yung mga serous fluid nyo. Diba, the doctor accidentally punctures a vein or an artery, it would cause a traumatic tap. So the synovial fluid would be red or brown. This could be seen in traumatic collection or hemorrhagic disorder. Then if your synovial fluid is milky class, most likely there's the presence of crystals. Now let's talk about the volume of your synovial fluid. So as mentioned earlier, it should not exceed 3.5 ml. The volume to aspirate is recorded at bedside and indicated in lab reports as well. So as medical technologies class, whenever you would encounter synovial fluid analysis, the first thing you need to know to take note is the volume. Take note of the volume, the color, the clarity. Basically, the physical aspects of your body fluid. Now, volume could expand up to 25 ml class in cases of infection and inflammation. So these are the normal values of your synovial fluid. So the volume should be less than 3.5 ml. Color should be colorless to pale yellow, and clarity should be clear. Now let's talk about the viscosity of your synovial fluid. Now, whenever the doctor would collect the synovial fluid, there is a test. There is a test class wherein you would dispense the synovial fluid into a test tube, one drop at a time. Then there would be a formation of a string around 4 to 6 centimeter before the string would be broken down. The reason for this class is due to the polymerization of the hyaluronic acid and is essential for the proper joint lubrication. So again, to explain class, whenever the doctor collects the synovial fluid, he will perform what we call a string test. So magko-continuously drop siya ng synovial fluid into a test tube until it forms a string. The string, the normal centimeter or the normal length of the string should be around 4 to 6 centimeter before it starts to break down or cut off. So this is the reason why your why your sample or your synovial fluid is viscous is because of the polymerization of hyaluronic acid. Now another test, you could use also class an applicator stick or a pasture pipette to check if it is able to produce a string. Now you could also use certain reagents class for the clotting of synovial fluid. So normal synovial fluid would form a solid clot surrounded by a clear fluid. So when you would add class 2% to 5% acetic acid, then you wait, and if it's normal, it would form a solid clot surrounded by a clear fluid. Then you could also measure class the amount of hyaluronate polymerization, meaning class this is used to assess if the synovial fluid contains a normal amount of hyaluronic acid. So to do this, you could use the ropes or the mucin clot test. So mucin clot test will detect the integrity of polymerization of the hyaluronic acid. So you would add 1 part synovial fluid, 4 parts 2 to 5% acetic acid, forming a clot. If patient is normal, a solid clot will be produced. So ito yan class, ito yung test na yan, ito yung ropes or mucin clot test. Itong nag-use ng 2 to 5% acetic acid. So if it's a normal result, a solid clot surrounded by a clear fluid. Then you would describe the results according to the following. So if the result is good, the interpretation class, if after adding your 2 to 5% acetic acid and it forms a solid clot, the interpretation would be good. If it's a soft clot, it would be fair. If a friable clot, it would be low. And if there's no clot, the interpretation would be poor. So this is the normal values class. So viscosity, able to form a string 4 to 6 centimeter long. Leukocyte count, less than 200 cells per UL. Neutrophils, less than 25% of the entire differential count. Crystals, not present. Glucose, less than 10 milligram per DL, lower than blood glucose. Then total protein, less than 3 grams per DL. So, i-discuss ko later class yung mga leukocyte counts, glucose, and total protein. So, let's go now to the microscopic examination. So, for the microscopic examination, you're going to do cell count, differential count, crystal identification, and inclusion bodies identification. So, let's start with your cell count. So whenever you would perform a cell count of the synovial fluid, the first step is to check its appearance. If the specimen is clear class, there is no need for dilution. Kasi pag gagamit ka ng cell count, you would be performing dilution sa kahit anong body fluid. But if the synovial is clear class, no dilution is needed. But if it is viscous and cloudy, then you need to do some preparations class. An example, if you have a very viscous fluid, you need to add 1 drop. If you have a very viscous synovial fluid, you need to add 1 drop of 0.05% hyaluronidase in phosphate buffer per ml of fluid and incubate it at 37 degrees for 5 minutes to liquefy the synovial fluid. So if you have very viscous class, you need to liquefy it by adding 0.05% hyaluronidase. Now you would start using diluents class. So the most commonly used diluent here is your NSS or your normal saline solution. It is necessary, if it is necessary to lyse RBC class, you could also use a hypotonic saline. So let's say yung synovial fluid nyo is red or brown. It could be a sign that there is RBCs present. So you could use another type of diluent, a hypotonic saline, usually 0.3%, 0.3% NSS or NSS that would contain saponin could also be used. The dilution ratio class is 1 is to 20. So 1 is to 20 is using 0.5 ml of synovial fluid plus 9.5 ml NSS as diluent. Then you could also add methylene blue class. So the purpose of methylene blue is to stain the WBC nuclei. So you would be able to easily identify WBCs. If you add methylene blue, yung nucleus ng WBC would be stained, allowing you to easily identify WBC. Permitting separation of RBCs and WBCs during counts performed on mixed specimen. Again, the normal WBC count should be less than 200 cells per UL. If you notice less than 200 cells per UL, it is recommended to count all 9 squares of the hemocytometer. But if you notice more than 200 cells per UL, it is up to your decision whether to count the 4 large WBC squares or the 5 small squares of the large RBC square. So pakitandaan to class, please remember this. If you notice less than 200 cells per UL, count all 9 squares. But if you notice more than 200 cells, you could just count the four corner large WBC squares or the 5 small squares of the large RBC square. Now, these are the lab findings class in different joint disorders. So if you have a non-inflammatory joint disorder, the WBC count would be less than 1,000 per UL. Neutrophil would be 30% in the diff count. Then the glucose would be normal. If it's immunologic origin, the joint disorder is of immunologic origin, the WBC count would be 2,000 to 7,000, 75,000 per UL. Neutro is greater than 50%. Glucose is decreased. Then if it's crystal induced class, up to 100,000 per UL. Neutro would be less than 70%. glucose would also be decreased. If it's a septic joint disorder, when you say septic class, bacterial infection has reached the joints, there would be WBC count of ranging 50,000 to 100,000 per UL. Neutrophil would be greater than 75%. Glucose would be decreased. Then if it's hemorrhagic class, WBCs would be equal to blood. Neutro would be equal to blood, and glucose would be normal. Now let's talk about the differential count class. So differential count, before doing differential count class, you need to treat first the viscosity. So you need to reduce its viscosity. Now the normal differential count of synovial fluid should be RBCs less than 2,000 cells per UL. For WBCs naman class, less than 200 cells per UL. Then for the normal differential count class, monocytes and macrophage are around 65%, neutrophil less than 25%, and lymphocytes would be less than 15%. So this is the normal values for a joint differential count. Now, neutrophils class normally account for about 20% of WBCs. They generally exceed 50% class, so they would reach 50% of diff count in urate gout and pseudo gout, rheumatoid arthritis, bacterial arthritis. Then lymphocytes class 15% of synovial fluid cells, increase in non-septic inflammation like immunologic disorders. Then number three, macrophage. This is a tissue WBC, most common cell present in a normal synovial fluid. They are approximately 65% of cell count, and they would be increased in viral infections. Then we have your synoviocytes. These are found in the synovial membrane, similar to macrophage and may resemble mesothelial cell. Normally present in the synovial fluid, especially after arthrosynthesis. Then we have the so-called LE cells or the lupus erythematosus cells. These are neutrophils class that have phagocytized the nuclei of degenerating cell. They are usually seen in patients suffering from SLE or your systemic lupus erythematosus and rheumatoid arthritis. Then we have your Reiter cell or the neutrophage. This is a vacuolated macrophage with ingested neutrophil, indicative of autoimmune disorders. Then we have your RA cell or your rhagocyte. Rhagocyte class, please take note, is a neutrophil with dark cytoplasmic granules containing immune complexes. Precipitated immune complex called rheumatoid factor, seen in rheumatoid arthritis and immunologic inflammation. Then we have your cartilage cells. These are large multinucleated cells that are seen in osteoarthritis. Then we have your rice bodies. These are free floating aggregates of tissue resembling Polish rice. They are made up of collagen and fibrin, and they are seen in TB, septic, and rheumatoid arthritis. Then we have your lipid bodies and your fat droplets associated with trauma, aseptic necrosis, and rheumatoid arthritis. So on the right side class, itong picture na to, yung tube A nyo is the ground pepper bodies and yung tube B nyo are the rice bodies. So if you take a look class, mukha siyang Polish rice, puti. So a ground pepper appearance from pigmented cartilage may be the result of a metabolic disorder. Take note of that class. An example of a metabolic disorder class is yung diabetes. So if a patient is diabetic, the synovial fluid would contain this pepper appearance, usually from pigmented cartilage fragments due to the patient being diabetic. Now I want you to memorize this class. Ito rin siya. This is what I just mentioned, but this time including yung description niya and stains. But I won't discuss them anymore. Do memorize this. This will definitely come out in your quiz and your exam. So These are the abnormal cells and inclusion bodies in synovial fluid. Then we have the crystal identification in synovial fluid. So there are two crystals class that I want you to memorize or I want you to remember when it comes to synovial fluid. We have your MSU or the monosodium urate and the CPPD or the calcium pyrophosphate dihydrate. So your MSU class or your monosodium urate is found in gout. They appear as needles. Now, when you view them using a polarizing microscope, they would produce what we call a negative birefringence. So crystals would align parallel with the compensator filter. Then we also have your corticosteroid crystals. This is usually caused by the injection of medication. So may mga patients kasi class, when they are suffering from gout, they are suffering from an inflammatory disease involving their joints, they would be taking corticosteroids. So this would cause corticosteroid crystals. They would appear as flat, variable shape plates. In polarizing light, you would view them as positive and negative. Then we have your calcium pyrophosphate dihydrate. Ang significance nito class, this is seen in pseudo-gout and chondrocalcinosis. The reason why I want you to remember this two class because MSU is the one found in true gout. Yung talagang gout talaga class. But CPPD is seen in pseudo-gout and chondrocalcinosis. Pag sinabi mong pseudo, false. Hindi talaga siya gout. CPPD class or your calcium pyrophosphate dihydrate would appear as rhomboid squares or rods. They are seen in positive birefringence. Crystals are perpendicular with the compensator filter. So si MSU class parallel siya dun sa compensator. Si negative birefringence siya. Si CPPD nyo positive birefringence pero perpendicular siya sa compensator filter. So pakitandaan itong nasa baba class. Negative birefringence, it will produce a yellow color for MSU. Positive birefringence, blue color, CPPD. Then we have your apatite crystals, which are also known as your calcium phosphate crystals. These are seen in apatite gout, osteoarthritis, calcified cartilage degeneration. They appear as small particles. They have no birefringence. Then we have your cholesterol crystals, seen in extracellular chronic inflammation. They appear as notch rhomboid plates. Birefringence is negative birefringence. Then we have your CAOX or your calcium oxalate, seen in oxalate gout, renal dialysis. So yung oxalate gout class, if you're the type of person that likes to eat tomatoes, yung mga maano sa ano class, yung mga seeds, tomatoes, you could develop that type. They appear as envelopes and they have a negative birefringence. So MSU class or your monosodium urate is seen extracellularly or within neutrophils and they are sticking through its cytoplasm. They also lyse phagosome membrane. While your calcium pyrophosphate dihydrate or your CPPD is located within the vacuoles of neutrophils. So si MSU nandun sa cytoplasm class, si CPPD nandun sa vacuoles ng neutrophil. Then gout class is the frequently caused by increased serum uric acid resulting from impaired metabolism of purines. So whenever you would eat too much meat class or too much food containing high amounts of purine, you could develop this disorder. Usually in consumption of purine content foods, alcohol, and fructose. Then chemotherapy treatment of leukemias and decreased renal excretion of uric acid. Then you have your pseudogout. So this is most often associated with degenerative arthritis, producing cartilage calcification and endocrine disorders that would produce elevated serum calcium level. To simplify, classic gout nyo, gout is caused by increased uric acid. Si pseudogout nyo naman is caused by increased serum calcium. The reason why there's increased serum calcium in pseudogout is because of increased degeneration of your cartilage. Then artifacts could also be seen, class, such as your talcum powder and starch from gloves, precipitated anticoagulants when you use powdered anticoagulants, dust and scratches on slides and cover slips. That's why it's very important, class, that you do not reuse slides when you view bodily fluids. Now let's go to the chemical examination of synovial fluid. So we have your glucose in synovial fluid. This is the most frequently requested test because markedly markedly decreased glucose values indicate inflammatory or group 2 or septic group 3 disorders. So later class, I will discuss ano yung mga group disorders na yan. So normal synovial fluid class should not be more than 10 milligram per dl lower than the blood value or the blood glucose. So let's say you have a blood glucose of 120 milligram per dl. It is expected class that your synovial fluid glucose should fall between 100 to 120 milligram per dl. Then we have your lactic acid. So whenever there would be lactic acid class, there would be bacterial infection. So normal lactic acid level is less than 25 milligram per dl. Levels greater than 30 milligram per dl are associated with septic arthritis due to gram-positive cocci and gram-negative bacilli. Measurement of D-lactate levels in the said fluid appears to be a useful method for the rapid diagnosis of bacterial synovitis. Then we have your protein in synovial fluid. Normal synovial fluid protein is less than 3 grams per dl of protein. Increased levels are found in inflammatory and hemorrhagic disorders like your ankylosing spondylitis, arthritis, arthropathies, Crohn's disease, gout, psoriasis, Reiter syndrome, and ulcerative colitis. Then we have your uric acid in synovial fluid. So this is often measured as a first evaluation in suspected cases of gout. Synovial fluid uric acid normal value falls between 6 to 8 milligram per dl. So elevation of serum uric acid in cases of gout is well known. Demonstration of an elevated synovial fluid uric acid level may be used to confirm the diagnosis when the presence of crystals cannot be demonstrated in the fluid. So let's say class you tested the synovial fluid microscopically. You weren't able to find any crystals. So what the doctor would do or would ask is that you would be testing the uric acid. So if the synovial fluid is greater than 8 milligram per dl, then most likely the patient has gout. Now let's go to the microbiologic examination of synovial fluid. So you would usually test for the following bacteria and pathogens class: Staphylococcus, Streptococcus, Haemophilus, and Neisseria. You would be using class sa synovial fluid. You are required to use what we call CAP. CAP stands for chocolate agar plate. Chocolate agar plate are used for fastidious bacteria. When you say fastidious bacteria, they are difficult. They are difficult to grow, and they would require special nutrients, specifically the X factor and the V factor. X factor class, this is known as your hemin, and the V factor is known as your NAT. So usually used for Haemophilus, Neisseria, gonorrhea would also infect the synovial fluid. So you would use the chocolate agar plate for these two bacteria class, Haemophilus and Neisseria gonorrhea. Then arthritis is a frequent complication of Lyme disease class. So Lyme disease class are usually transmitted by tick bites. So when you suffer Lyme disease, you could develop arthritis. So you need to demonstrate antibodies to the causative agent Borrelia burgdorferi. So Borrelia burgdorferi class is a type of bacteria in the patient's serum can confirm the cause of arthritis. So if positive ka sa antibodies for Borrelia burgdorferi, your arthritis is caused by Lyme disease. Then these are the classifications of joint disorders. So we have the groupings class. So for the groupings class, we have the non-inflammatory, the inflammatory, then we have the septic and the hemorrhagic. So let's start first with the non-inflammatory. So the non-inflammatory group class would involve degenerative joint disorders and osteoarthritis. Findings would include clear yellow synovial fluid, good viscosity, WBCs of less than 1,000 per UL, neutrophils less than 30%, and normal glucose. For the inflammatory naman class, there are two groups. We have the immunologic and the crystal induced. So let's start first with the immunologic under inflammatory. Under immunologic, we have your RA, rheumatoid arthritis, SLE, scleroderma, polymyositis, ankylosing spondylitis, and rheumatic fever, and Lyme arthritis. So all of these class are immunologic in origin. When you say immunologic in origin, they involve antibodies. So the synovial fluid would appear cloudy, yellow fluid, poor viscosity. WBCs would be around 2,000 to 75,000 per UL. Neutrophils would be greater than 50%. Decrease glucose levels. Then for there would also be possible autoantibodies present. Then for the crystal induced, we have your gout and pseudo-gout. Again, kapag gout class, increase uric acid. Kapag pseudo-gout, increase calcium due to degenerative arthritis. So this is a crystal-induced origin. So the synovial fluid would appear cloudy or milky fluid, has low viscosity, WBCs up to 100,000 per UL. Neutrophils less than 70%, decreased glucose level. Crystals are present. Then, if it's septic, this would be seen in microbial infection. So the synovial fluid would be cloudy, yellow green in color, variable viscosity. WBC count would be 50,000 to 100,000 per UL. Neutrophils would be less than 70%. Decrease glucose levels, positive gram stain culture, and gram stain. Sorry, class. This should be greater than 75% for septic. Take note yan. Then for hemorrhagic, this would be traumatic injury, coagulation deficiencies. Synovial fluid would be cloudy, red fluid, low viscosity. WBC is equal to blood, neutrophil equal to blood, then normal glucose level, then RBC is present. Then take note of the lab findings class. So this is the summary. Paki-memorize lahat to class. This will definitely come out in your quiz and exam. Now let's talk about the different diseases. Let's start with your RA or your rheumatoid arthritis. So this is an autoimmune disease that causes joint pain and damage throughout your body. You need to check class the following. If a patient has RA, you need to check what we call your ANA test. ANA test is an immunoassay class. So you would be detecting different antibodies. Then another test is your CRP or your C-reactive protein. When your body is suffering from an infection or an inflammation class, there would be an increased CRP, and this is produced by your liver. Then another test is the rheumatoid factor test. High levels of rheumatoid factor are associated with autoimmune disorders, especially RA. So ano ba tong rheumatoid factor na to, class? Rheumatoid factor class is an autoantibody responsible for destroying the joints. So kapag may RA ka class, your joints are bulging and swelling. as well as the redness of the area because of the deposition of antibodies in the fluid capsule. Then we have your osteoarthritis. So this is the most common of arthritis affecting millions of people worldwide. This is common in people class as early as 50 years old. Pwede ka na mag-develop ng arthritis. Occurs when the protective cartilage that cushions the end of your bones wears down over time. Usually caused by old age, obesity, and repeated stress on the joints. Seen in athletes, and are some of the factors which predisposes to osteoarthritis. This is also known as your wear and tear arthritis. So if you're the type of athlete or a person class that would jog every day or daily, you could develop this in the future. That's why you need to have a balanced diet of vitamin D and calcium. Then we have your gouty arthritis. So the gouty, as mentioned, class, is caused by your increased uric acid. So this is often at the joint at the base of the big toe. Occurs when urate crystals accumulate in your joint. Enhanced when eating purine-rich food like meat and seafood, as well as beans, legumes, and nuts. Symptoms of gout always occur suddenly and often at night. So gabi siya class. These are the symptoms. There would be intense joint pain, inflammation, warm and redness, discomfort, and if you view your synovial fluid under a microscope, there would be the presence of MSU. Now, tophus class, when you hear the word tophus, this refers to the deposition of crystals in your fingers. Tophus can be removed through surgery and are given with urate lowering drugs such as your allopurinol to normalize blood uric acid. Then we have your pseudogout. Crystal-induced arthritis occurs when calcium pyrophosphate crystals are found in your synovial fluid, attributed to hyperparathyroidism, hypothyroidism, and hypercalcemia. Then we have your septic arthritis. The infection comes from bacteria, travels through the bloodstream, and enters another part of your body. Treatment involves draining of the joint with a needle or surgically. Antibiotics could also be used. So fluid from the septic arthritis undergoes culture and sensitivity. Bacteria is grown in chocolate agar to detect again Haemophilus and your Neisseria. So do remember those two bacteria for gout. So these are the references class for your lesson 9 synovial fluid. Thank you.